Welcome back to PBH435. Today we're going to be talking about preventing substance abuse. We've addressed this a couple of times in our discussion questions so far, and we're going to dig into some details about what we're actually talking about when we discuss this. So many times when we discuss prevention, we come down to this idea of a drug-free society. It's something we've discussed quite a bit in the United States over the past several decades. And I'd like to start by talking a little bit about what this means. For most people, when they talk about a drug-free society, they're pretty clearly talking about no users of what we consider dangerous drugs. Maybe things that you wouldn't want your brother or sister to be using. Things like heroin, cocaine, meth. So ones that we pretty clearly define as dangerous. So what about alcohol? For some communities in Las Vegas, consuming alcohol is definitely against social norms, but for a lot of us, this is something that we may actually do along with members of our family. So alcohol is one that we need to think through carefully. It's definitely a drug. We do classify it that way, but it's not one that has that kind of social norm prejudice against it. So what about tobacco? When we talk about a drug-free society, do we talk about people not using tobacco? And this is one where we've seen social norm change over the past several decades. Something that was widely acceptable within the past 30 years or so has definitely changed its role when we talk about whether it's part of a drug-free society or not. Marijuana, this is an interesting one to be looking at right now because we're seeing current social norm change. If we want a drug-free society, does that mean that marijuana is part of the picture or not? And what about prescription drugs? Many of us take these on a daily basis to keep our long-term health headed in a positive direction, maybe to address a current acute condition, maybe antibiotics for an infection. So if we are currently taking prescription drugs and we talk about wanting a drug-free society, is that something that we're going to include? Because remember, our definition of a drug is any substance, natural or artificial, other than food, that by its chemical nature alters structure or function in a living organism. So all of these substances on the list above fit that definition. And if we talk about truly having a drug-free society, then what we're saying is we want to eliminate all of these from our current living conditions. So some food for thought before we get started. So for most of us, what we're talking about if we talk about a drug-free society is getting rid of those dangerous drugs. It may be different for different groups. Some folks do actually want to prevent all drug use, including alcohol. There are some social groups in the United States who consider alcohol definitely a social ill, and they put that on that list of drugs to prevent. For a lot of us, what we're talking about really is drug abuse, that substance abuse issue where it becomes harmful in other ways in the person's life. But when we talk about trying to remove drug use, we're talking about trying to eliminate something that has been part of human history for as long as we know about humans. And the reality is that if we think about the number of people in our society who are truly drug-free, it is a very small percentage, and the relative number of people who have problems with legal drugs is actually quite small. And part of the reason why that is because we actually have prevention efforts that focus on teaching people how to use those drugs safely. So we start to wonder whether we can do that same thing with drugs that we currently consider illicit or illegal. So from a public health perspective, any kind of prevention program that we do, we're going to want to have specific goals from that, and then we're going to want to evaluate our outcomes. Are we doing what we said we would do? So let's talk about a traditional approach, one that you may be familiar with. This is presenting negative information about drugs in schools, scaring students with some of the terrible things that could happen if they use these terrible substances. So the goal of it is supposed to be preventing drug use. That's our approach. Our goal is to stop students from using drugs altogether later in their lives, or perhaps dangerous drugs, or the drugs covered by the program. So when we talk about evaluating how effective it is, the question we're going to be asking is how many of the students that went through our program ended up using drugs in the future? Now, this whole idea makes a lot of sense when we talk about it. If we're going to be investing money in these programs, we'd like to make sure that they're working. But until the early 1970s, many of the drug prevention programs that we funded here in the United States were not actually evaluated. And an important thing to think about as we talk about this idea of drug prevention is that we need to match, as a society, our resources with our goals. If preventing drug abuse is truly important to us, then we should fund it at a level that indicates how important it is. And the reality is that only 10% of the money that we currently spend here in the United States on drug abuse and dependence goes towards prevention. Prevention is not really very exciting. So we tend not to get a lot of funding for it. And we see actually results in accordance to the level at which we fund it. So when we talk about prevention from a public health perspective, there are a couple of different models we can use to structure our programs. The first one is the primary, secondary, and tertiary prevention pyramid. Most programs that we talk about do actually focus on either primary prevention or tertiary prevention. When actually our most effective group to work with, based on data we've collected, is the middle group, secondary prevention. So let's talk a little bit about how this works. So primary prevention. This would be aimed at people who, from the public health perspective, are not yet sick. So in the population here, these would be people who haven't yet tried drugs. It may help students not to choose drugs. It may encourage abstinence, but it also may arouse curiosity. We'll talk about that in a little bit as well. Now, secondary prevention. We're going to be looking at people who are already engaged in the behavior. Mammograms are an example of secondary prevention from another public health model. You don't get a mammogram because you're healthy. You get a mammogram because you might be sick. It's a screening test, and we'd like to catch your disease as early as possible, get you into treatment, least possible consequences, both in terms of your health and the expense of your treatment. So if we take that over to the substance abuse model, what we're looking at really here is people who've experimented with drugs but are not yet abusing or dependent. And our goal would be to stop that person from becoming an abuser or to stop that person from encountering and using more dangerous drugs. And you've probably been exposed to programs targeted at this when you've been exposed as a student here at UNLV to programs that encourage you to use alcohol responsibly. There may be programs out there that encourage you not to drink at all, but we found that programs that encourage people to be responsible tend to be more effective. And you may be thinking about the social environment here at UNLV. You might be able to come up with some reasons on your own why that might be true. And then finally, tertiary prevention. People who are already sick, trying to prevent the long-term consequences of their disease. And if we think about this with our substance abuse model, tertiary prevention here would be aimed at people who have already become abusers and been through treatment. And our goal here would be to prevent potential relapse. So most of our funding here in the U.S. goes to primary and tertiary, which can be a bit frustrating because secondary prevention is one of the tools that we found to be most effective. So another way that we can look at prevention programs is this model called the continuum of care. And in this model, where we categorize a public health intervention depends on the target population. It can be universal, selective, or indicated prevention. So universal prevention, this would be an entire population. So DARE is an example of this. DARE does not select high-risk students. It selects an entire school and oftentimes an entire community, like in Clark County, where the program will be administered. So selective prevention is a little different. In selective prevention, we select high-risk groups within a population. And an example of this for substance abuse would be students who are doing poorly at school, maybe students who've been disciplined for anger management issues, students who are already at higher risk of becoming drug abusers. And then indicated prevention, these will be people who have moved beyond being high risk to actually being users. So individuals who've perhaps been arrested for their first DUI. So I'm going to wrap up the first of our mini lectures for today there. So I'm going to wrap up the first of the mini lectures for this week there. So far we've talked about what we truly mean when we talk about a drug-free society. That probably what we're talking about is dangerous drugs, although we're not that specific. And actually, as we've discussed, that definition can be different for different people. And then we talked about two models for prevention, the traditional public health model and then the continuum of care model. Next lecture we'll be discussing prevention programs in schools.